February 28th, the Vice Chancellor of the University, Professor John Owusu Japan, assembled an emergency meeting of officials from UHAS as well as whole Teaching Hospital to strategize on an emergency preparedness and response plan toward countering the coronavirus, what we now know as pandemic, but at the time it was a medical threat. And so that group met that day, and out of that meeting, 4 subgroups were formed. All these comprised officials from UHAS and also professionals from Whole Teaching Hospital. The 4 subgroups that were formed included a clinical subgroup, a laboratory or diagnostic subgroup, education and training subgroup, and publicity and advocacy subgroup. Our main focus initially, of course, was our student body. Our primary responsibility is to make sure that all students, faculty and staff of UHAS are safe, and beyond that, the extended publics that they interact with and come into contact with, people who visit our campus, people that our students go out into town to go receive services from, and others that interact with us on an ongoing basis, and of course the families that our faculty and our staff go home to every day. So this is our internal audience that was our main focus, but we realized that this was something that would have to extend out to encompass the larger population that we also deal with on a regular basis. And so with that, what I will say is that we have put in a lot of work. We have very, very detailed strategic plans that we have drawn covering all these 4 areas. The fact that the university has had to close down under presidential order as of this morning is not derailing us from the purpose for which the task force was formed. Okay, so the objectives of the clinical subgroup are to send to staff of UHAS and Whole Teaching Hospital. 2, to develop management protocols for suspected cases. 3, to identify a suitable isolation ward. 4, to mobilize resources, as in human resources as well as material needed, to set up a referral system for lab samples and patients. And these are the main objectives of the clinical subgroup. So this has more to do with actual handling of patients who arrive at the hospital and what are we going to do with them and how are we going to treat them. The other subgroup that has to do with the science of this is the diagnostic subgroup. Once someone comes in there and is identified as a potential coronavirus patient and they take samples, what then happens? So this is the group that was formed to look into that. Their objectives are as follows: to train staff, to set up the laboratory itself, because of course you don't want to use existing lab space to do this work. So it requires special equipment and special training, and so they're there to set up that laboratory, to develop protocols around the collection of samples and the handling of patients, to provide IPC support to Whole Teaching Hospital, and to develop a budget of resource needs. In fact, a list to draw up the resources that are needed on an ongoing basis, and then the budget, how much these would cost us on an ongoing basis. And the objectives of the education training subgroup are to sensitize all staff of the hospital, to train staff on how to handle patients, and to provide personal protective equipment, otherwise known as PPEs. The objectives of the publicity and advocacy subgroup are to plan and implement a public outreach campaign, to develop informational material for use by all subgroups, to manage media relations and information flow, to organize informational sessions and other activities to inform the public about institutional preparedness and response, and to update target groups with the latest global information.
The hospital has designated a ward for isolating suspected cases whilst we are testing them. There is a protocol for triaging that begins right from the hospital reception for whichever area of the hospital somebody is presenting to, whether to the maternity, to the children's block, to the surgical or medical. There is a set of case-based form that we use to screen, and if somebody fits the criteria, then we move the person to another area for another analysis. If we think the person is a suspected case, we go ahead and take the samples. And then currently we ship the samples to Noguchi in Accra for the testing to be done. Once the results are in, if it is negative, then we can continue with whatever treatment we have started for the person. And if the person has to be discharged, we can do that. But if we need to keep the person, then we can continue to also do that. There are plans to expand the current facility that we have to be able to take in more people in case in-country transmission also occurs. One other area that the clinical team has been looking at is to try and set up testing facility here. The School of Basic and Biomedical Sciences and the School of Medicine have the resources, human resources, to be able to perform the tests that are currently used in the diagnosis. What remains is to be able to have a separate laboratory area rather than the ones we usually use because of safety concerns, and to be able to run these tests. So protocols are being developed, and we are hoping that with the support of the Ministry of Health and Education and development partners, we'll be able to set up that lab to also add to testing capacity for the country. Currently, staff have been sensitized on the disease, and we've also gone ahead to sensitize again on normal infection and prevention control measures that they already know and are supposed to practice. 3 of the staff from the hospital are currently in Accra taking part in a national training that is ongoing. And when they come, we'll also go ahead to continue training our staff. It has to be ongoing because you know that sometimes we need reminders, constant reminders, to be able to take good care of ourselves and our patients.